roll.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Do you want to add if you're in Wayne County?
Oh, yeah. Yep, I'm in Wayne County. I thought we just had to say it if we weren't in Wayne County.
Right.
That
Okay.
is correct.
I didn't hear you say if you're not. I was talking to the clerk. I didn't hear that part of the.
Oh, got it. Okay, got it.
Commissioner Dobb.
Here.
Commissioner Anderson. Commissioner Killeen.
Right here.
Chair Baker McCormick.
Here.
I have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none.
C, approval of the July 13th, 2021 meeting minutes.
Is there a motion for approval?
So moved, Madam Chair.
Support.
Been moved and supported. Is there any corrections to the minutes? All those in favor?
Aye.
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 Any opposed? Motion passed. Next item, please.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, an update regarding COVID-19.
And is Ms. Jordan on the line?
Yes, I am. Good afternoon.
Welcome. Can you introduce yourself and go ahead with your report and update?
Good afternoon. My name is Melita Jordan, Director of the Department of Health, Human and Veteran Services. And I am going to provide a brief COVID-19 weekly report for the week of July 18th through the 24th. Over the past week, we've had a total of 333 new cases and 4 new deaths. This is an average of new cases were 41 per day, which is a 53% increase in confirmed cases from the previous week of 7/18 through 7/24. Of the new cases, 68% of those cases were Caucasian, 19% were African American, and 25% by ethnicity were Arab, and 4% were Hispanic and Latino. We also, by new cases, had 54% were female, and again, 46% were male, and the average age has been 36.3. I also just wanted to share that we are in the process of trying to develop by the jurisdictions for you to provide you with your specific communities. And so we are working on that, and therefore we'll get that information to you as well so that you'll have a list each week in terms of what your communities actually look like. So bear with me, and I hope to get that to you by next week for sure. Also, those 5 municipalities, Dearborn, we had 50 cases or 15% of the total cases, followed by Dearborn Heights, 42 cases or 13%. Canton Township, 32 cases and 10%. In addition to that, we've had a positivity rate, which has been increasing to 2.8% over the past week. The variant tracing, we've had 1,487 lab confirmed variants cases that has been reported. 94% is the Alpha B117, and followed by 3% of the Gamma P1 and 2% of the Epsilon or B1429 or the California strand. Also, there has been no increase from the 8 Delta strands reported since last week. In addition, there is a 65.1% those individuals who've had the first dose, and 59.8% in out of Wayne County for those that with the second dose. We also mentioned we would provide you with the breakthrough information. So the vaccine breakthrough rate in Wayne County is less than 1% of those vaccinated. In the county, there has been 919 total vaccine breakthrough cases that has been reported to us. In addition, the in-home vaccine numbers, we have currently a total of 250 in-home vaccines that we're providing. And we're also, as I mentioned last week, working with our faith-based organizations to make sure that we can get the sick and shut-in list from them and actually going out to the homes to provide the vaccines in-home as well. I think that is some of the highlights that I wanted to cover. Are there any questions?
Yes. Do you get a daily report of vaccinations, or how does that work? Is it weekly?
We get it twice a week now. We were getting it more frequently. However, the state is providing it to us twice a week. And so we're trying to make sure that we provide that information to you, particularly with the positivity rate that we are now getting. I think it's on Thursdays that Thursdays we're receiving that information on the positivity. So we're not able to give it on Monday as we were doing that before.
Okay.
And then for the areas where we are actually out in the communities, I am getting that report on a weekly basis also from our communities where we're trying to target to make sure that we are monitoring those risk communities. And so that information I'm getting on a weekly basis. The staff does turn that in on a daily and they're collecting it, but I report it out on a weekly basis.
Okay, thank you. Thank you for that.
I have
All
a
right.
question. Oh.
Yes, any commissioners have any questions?
I do.
I'm sorry, does
I'm
Commissioner Marecki go right ahead?
Thank you. The 1% breakthrough rate that you're talking about, is that the total so far, or is this just like in the last couple weeks? Has that number been looked at the whole time?
This is from last week. So we do have the total number of the breakthrough. And let me see where it's in one of my slides here. Which one? Right here. So that was just, so the total breakthrough that we have in the county has been 919, has been the total number. And that has been since, I don't have the, from the beginning, I think since the May, we're checking to see that right now, since either May 2021 through July of 26 is when we have had the 919 in terms of the breakthrough cases.
Okay, so you don't know what percentage that is? You just have the numbers on that?
Yes, it's been total, like I said, totally it's been less than 1%.
Okay.
That we've had for the county as far as the breakthrough is concerned. So
Okay.
We haven't had a large breakthrough in terms of those individuals who have been totally vaccinated since May up until July of 26.
Okay, great, thank you. That's,
sorry. Yes.
no, that's a great statistic to tell us. So I really appreciate that you gave us that. Thank you.
You're welcome.
Okay, any other commissioners have any questions? Thank you.
I do,
Marecki.
Madam Chair. This is Commissioner Dobb.
Hi, Commissioner Dobb.
Go right ahead, Commissioner.
Yes, Director Jordan. So I You mentioned getting us some community data, and I don't know if that's what you were referring to, but I'm looking for vaccination rates for my community. And Dr. Hamami was trying to work on that through the Lighthouse system that the state uses. And I know that we were seeing some of the maps in his presentations, but I don't know if it's possible to get us something that we can really drill down into our communities to see, like, is North Canton, for me, I'm just using as an
Sure.
example, is like the northwest part of Canton really kind of lagging behind, and maybe that's where I need to go make some phone calls or knock some doors and
So
put
let
out
me
some
answer you.
flyers to see, make people go and get vaccinated. And I am sure other commissioners would really like that information as well.
All right. Commissioner Dobb, that is what I'm referring to, is that, again, I know that all of you have been asking for the vaccination rates, and I'm trying to get that for you. And so we do have it listed in terms of each municipality or each jurisdiction. So it is a very long list. So since there are so many jurisdictions, my goal is to send that out to you so that you can have that. Again, as you can imagine, it does change somewhat. However, we are in those particular areas. And so I will send it through the appropriate channels to get that particular document to you. We do have it on the map. However, the map is a busy map, to be quite honest with you. You'll see many, many different colors. And so what I've asked staff to do is to be able to highlight with specific colors that sort of highlight those very high rates. And what my goal is to do is to provide you actually with the top, to sort of put the top areas or the top jurisdictions in one section so that you can actually see what they are. But if I just send you a map or show you the map, you will see that it crosses zip codes as well as census tracts. And I don't think most of you have everyone doesn't recognize census tracts, so you recognize your zip codes. But the zip codes and your census tracts actually cross one another. So when you look at the map, it does look like a busy map and you're not able to drill down. So my goal is to give you jurisdiction by jurisdiction, and maybe that then will help you to see where your areas are. But it is difficult for me to point out every single community within your jurisdiction with a zip code to say, this is where it's high at. But I can provide you with another Excel spreadsheet that I have that does do that. So I'm happy to send that to you as well. And as you look at that, you can then get a better idea also what's happening within your own community. So okay. I will have the staff send that through the appropriate channels to get that to you also.
Okay, that would be great. And then I just have one other question. So some news articles have been coming out last night and this morning about the CDC may be announcing pretty soon that vaccinated people should be wearing masks. I think it's only going to be for certain states that are experiencing very high COVID rates. And I don't believe Michigan is going to be one of them, but do you have any information on that? Do you think we might go back to having a recommendation for wearing masks?
Well, according to what actually Dr. Fauci has said, that is a possibility, that it's not just specific states. It was looking at the fact because of the Delta variant is actually gaining traction, that yes, even those individuals that have been fully vaccinated, yes, there may be some discussion in terms of making recommendations again to states that inside that you should wear a mask as well, even though you've already been vaccinated. And so I recognize that as we are coming up upon not only flu season, and as you remember last year, we basically were sheltered in so that we did not experience the flu season as we anticipated. However, now that we have opened up the cities and states, the likelihood now of having not only the variant in terms of being more prevalent, but also we have the risk as well in terms of the influenza virus, and also recognizing that there are other respiratory infections that are also will probably be more prevalent. And so their mask wearing is again being considered as a recommendation for people to wear inside. So that's the latest information that I have, also based on what CDC as well as Dr. Fauci from the NIH has spoken about.
Okay. All right, that makes sense. Thank you.
You're welcome.
That's
To
all I
that
have,
point,
Madam
to
Chair.
that point, Madam Chair.
I think we lost the chair.
Oh,
She sent me a quick note saying, can you take over? And now I can't find her even on the list to send a message back to say, yes, I can. Commissioner Marecki, you got the floor.
thank you. Thank you. Well, Doctor, let me ask you this. Are there actually cases that are being shown that fully vaccinated people are getting the Delta variant when we only have a 1% breakthrough right now and less than a 1% breakthrough? So what kind of numbers are those that they're actually, because a few weeks ago, they kept telling everybody that the vaccines were covering all the variants. So what has changed all of a sudden that Fauci is on this thing? I just read it today. It sounds like they're really going to start doing this again. And I haven't seen any numbers of people actually getting this variant fully vaccinated.
Okay, so again, in out of Wayne County, we still have only 8 of the Delta variant that has been reported to us to date. However, there are, I think a lot of the reports that you're hearing, there are other states though, where there has been an increase in the Delta variant and more people have been either with a positive case and or have become ill because of it, but not at the rate at previously, that they have not necessarily have had a severe illness. They have actually maybe have tested positive, but not with a really severe illness. However, that has not been the case right now, currently here in Wayne County and or here in the state of Michigan in terms of an outbreak of the Delta variant.
Do we know if the 8 cases that we had of the Delta variant, were those people fully vaccinated? Do you know by any chance?
I don't have that information in front of me to be able to comment on that, but I certainly can get back to you with that information to let you know what we have. I don't believe so, but we can certainly check. So I will ask Carol to follow up at the state level to find out for those individuals.
Yeah.
I will say in some states, however, the people who have become ill or have tested positive and have become hospitalized were unvaccinated.
Yeah. Yeah. Thank you. Because this is just very frustrating to me. We've gone through like over a year of hell with all this. And just to start saying this again, wearing masks inside, it's just very frustrating. So thank you. Yeah. Thank you for all the information you're getting for us. We really appreciate it.
Thank you.
Thanks, Madam Chair, or Mr. Vice Chair.
Yeah, well, whatever it is today, I'll roll with anything. Thank you, Commissioner Marecki. And I also have an answer for your question, Commissioner Marecki, and Dr. Jordan, correct me when I go wrong here. The national numbers show that if you have both doses of Moderna or Pfizer, then you are in the neighborhood of 95 to 96% protected against a reinfection. The numbers for people that are fully vaccinated with regards to the Delta variant show 88%. So some are getting through, no doubt about it. Dr. Jordan, to me, this is just simple biology. Did I not use the right title?
No. I was
Okay.
just about to say, you guys insist on making me a doctor. I am an advanced practice nurse, and I appreciate that. But I am an
Okay,
advanced practice nurse.
I'm not going to do that. So you're an APN.
Sorry about
That's
that.
right. MSN, APRN, CPM.
Okay.
Those are all those titles that I have.
So with your expertise, we're dealing with basic virus biology here. The numbers show that the ability for the Delta virus to infect people is 1.5 times the rate of the viruses we've seen so far. And certainly, I think there's been somewhere in the neighborhood of 5,000 variants. Overwhelmingly, variants have little or no effect. It's just biology. But you do get these occasional variants that have deleterious effects, and we're seeing one now. Over half of the world, it's a pandemic, is still not protected here. So we are still manufacturing more variants, and another one could pop up. When we look at the state of Michigan, about half of the state of Michigan is still vulnerable to the Delta variant when you take into account that, who has only one or none of the shots so far. In the city of Detroit, that's about 2 out of every 3 people that are very much in harm's way here. I know we're dealing with numbers on a day-by-day basis, Dr. Jordan, but as we look at these other states where Delta just has erupted and are accounting for 85% of the new infections, and I'm talking Louisiana, Alabama, Florida. Is there any doubt in your mind at all? There's not in mine, but in your mind, APN Jordan, that we're going to see our numbers climbing and climbing rapidly over the next month. Is there any doubt in your mind on that?
I'm not so sure it will climb in the next month, but I will say that the Delta variant is a very virulent variant. And so that has been clearly demonstrated in other states as well. And so because we are a global society, and of course we travel across states, needless to say, that we have the opportunity for it becoming contagious in other areas. And so recognizing that we do travel, that is a potential that the state and or the residents here will be impacted by that. So we do have to be prepared. So whether it be this month or 2 months from now, we recognize that this is particularly an issue that we have to be aware of and be prepared to address. And so we are already here at the department developing a strategic plan so that we can address what we anticipate to be in the fall. So therefore, we will be ready once again to implement those communicable prevention measures that will help prevent people from being infected.
That I have no doubt about, but I want to, in the media and in general conversation, people are like, woohoo, it's all over. I can pretty much do whatever I want. And we're not even close to that because there is nothing effective for the Delta currently. And we also, and I'm sure you've seen the same thing, Ms. Jordan, we have hospitals down south now that are putting off elective surgeries because they're so full of people that have the Delta variant. So I look at this practically. I know you have to be a little more reserved in your role, but I look at this practically and biologically and say the freight train is coming for us too. It's simple biology. It is coming. And what we're seeing now is the public health officials starting to get a little nervous about this. And so there becomes talk of, once everybody goes inside in the fall, which is, just a wonderful breeding ground for handing the virus, particularly the Delta virus. And let's hope to God we don't get a more dangerous variant emerge, but that's certainly a possibility too. And then kids going back to school, it's going to be a great incubator in the fall once people are staying inside more and more businesses open and schools open. I'm very much in the common sense sort of thing. This is dangerous. Wear a mask when you're around other people. End of story. Who cares whether we're going to argue over what the NIH and what the coming out of Washington and what regulators are saying? That's the wrong focus. The focus is practicalities with the biology of this virus and what our future is. And I won't ask you to comment on that Ms.
Can I
Jordan.
comment on it? Can I
Yeah,
comment on
please,
that?
please, Commissioner Marecki.
This is my frustration with this. Yep, you want everybody vaccinated. If they start telling everybody they all have to wear a mask again, what is the motivation to get vaccinated? I would have no motivation to get vaccinated if this keeps going on and on and on like this.
Well, it's going to
That
go
is my
on until we get to 75, 80% vaccination. There's no doubt about that. And again, I'm going to say nobody out of Washington has said everybody mask up for 24 hours a day, no matter what. There is a little more nuance to that, where you are and who you're around. So as I listen to this, I say to myself, people, just be practical. If you're watching, every announcement that comes out of Washington and then every stinking panel on CNN that opines about this kind of thing, what we're hearing out of Washington is if you're around other people, mask up.
Mr. Chair,
and do that. Yeah, Commissioner Dobb.
I'd like to make a comment to Commissioner Marecki's point. And I don't remember if it was Dr. Hamami or Carol who told us this, but all of these precautions, and they're like Swiss cheese. And when you put each one together, they all have holes. But when you put them all together, then you're gonna block the virus better. So you get vaccinated, you wear a mask, you practice social distancing. Every precaution that you can take will help you prevent getting the virus. So if you only do one thing, you're gonna have that piece of Swiss cheese with a few holes in it. But if you do two things, then maybe you're just going to have one hole that goes through. And if you do three things, then you're not going to have any holes. So that's why they're saying, like, hey, the cases are going up again. We've got this more contagious variant that's coming around. So we need you to take another precaution, because now you only have like an 88% chance, if you're fully vaccinated, of not getting it if it comes around you. So wear a mask when you're at the grocery store, and just try and keep distance from people when you can. Just be a little bit more cautious.
Yeah, I understand why they're saying it, but I think people should be making decisions. If people are comfortable and they've been vaccinated, I just don't think this thing can keep going like this. And I totally agree. If I wasn't vaccinated, I'd be taking every precaution to do so. But
right. Well, and it's going to keep going until we get everybody vaccinated and we can get this off of
we'll see.
the face of the earth.
Especially with the Delta out there,
Yeah.
which is so insidious. And if we get another one like that, look the heck out. But I've been cautious about saying anything in public as our numbers are increasing. But if you go back over the last 3-4 weeks, you'll see, even though the numbers are still relatively low, you see a 50% jump each week for the last month in the number of people in Michigan that have contracted the virus. And that's just going to keep continuing, right? It's like save up 1 penny on day 1, 2 pennies on day 2, 3 pennies on day 3. How much money do you have at the end of the month? An old elementary school math problem. And when you do that, you find out at the end of the month, you've got lots of money. So that's just the way I'm looking at it. Common sense. Don't get it's dangerous to everybody. Mask up when you're around other people. And it's not just you contracting the virus. It's also the ability to spread the virus to others that may be less susceptible to you. So
that's another discussion, but we've discussed this for a long time, so I don't want to keep going.
The only thing I would add that I didn't say earlier is that the state at this point is testing samples of the Delta variant. So we're not testing every specimen that comes through the lab for the variant. So currently, as I mentioned, we have 8 of the Delta variant that's been reported. But remember, that is based on a sample. So the capacity is not there to do this on every sample that the state receives. And so we must take that into consideration as well. So I just wanted to share that in terms of the conversation.
Thank you.
So it's a very good discussion. Thank you to all my colleagues. Blame the chair of the committee for connectivity problems and getting me in here to extend the conversation. So if there are no other questions, I do want to move the agenda. I want to thank Ms. Jordan for the report. We look forward to the numbers. I guess we look forward to the numbers 2 weeks from now to really see where we're at, but it's not good. Anything else from my colleagues on this? All right, we're moving the agenda then. Madam Clerk, what's up next? Thank you, Ms. Jordan, for the report. Thank you very much. Madam Clerk, what's up next?
Item 2, forwarding notification of an emergency procurement report for a purchase order with McKesson Medical Surgical Government Solutions.
Ms. Osterberry, are you introducing this?
Yes, hi, Carol Osterberry, Health Officer, Public Health Division Director. And yes, this was emergency procurement with McKesson, medical supplies for supplies we need to purchase for the COVID vaccination clinics.
Okay, and I see this was back in May when it was submitted. So have we purchased all of this equipment now?
Yes,
So this is just reporting back on a receive and file item under emergency procurement.
that is correct.
Questions from commissioners on this item?
I'll move to receive and file.
Is there support?
Support.
Questions from committee members on the item on the floor before us? Hearing none, we'll go to a vote, and it's just a voice vote on a receive and file. All in favor, please say aye.
Aye.
Opposed? Abstentions? Hearing none, Madam Clerk, how's item 3?
Item 3, forwarding notification of an emergency procurement report for a purchase order with ACP Creative IT, LLC, DBA Arlington.
Well, I don't know if that was a motion to approve, but but I don't think that sounded like any of my colleagues. So I'm going to need, who's introduced? Is this our health officer, Ms. Osterberry, introducing this again?
Yes,
It's
I
her dog.
apologize. I'm home. That was the dog.
The commission's going to the dogs. It's finally
Yes.
proven.
Anyways, yes, this was emergency procurement, and we needed to purchase, these Surface Pro laptop computers for the staff to use out at the COVID vaccine clinics because they were out, in the community.
Yeah. And are they all provided this now for everybody working in the community? They got a laptop?
Yes.
Okay. Pleasure of the committee.
I'll move approval.
That's a motion, receive and file.
Yes,
Is there
yes,
support?
it is motion.
I got you. Okay,
I'll support.
it's been moved and supported to receive and file. Any other questions on this? Hearing none, voice vote on a receive and file. All in favor, please say aye.
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 Opposed? Abstentions? All righty. Thank you very much. We'll go back to the clerk, Madam Clerk. Item 4, please.
Item 4, forwarding notification of an emergency procurement report for a contract with Brookwood Capital.
So this was for masks, and I see this was originally dated October 30, 2020. Is that you again, Ms. Osterberry, or does,
Yes, it is. Yes.
okay.
And again, when back last fall, we purchased, as this says, the Velcro masks. We also purchased masks for children and masks for adults. So this was, again, a large, order for masks, and it was all done through procurement.
The neoprene masks were the
Mhm.
ones that had the county logo on it?
Yes.
And I see in the paperwork, we purchased something like 2 million of those.
Yes, we, and actually, a lot of those were used for our own, emergency, EMS, emergency workers, the sheriff's department, and then they went out to the community for all of
Right.
those, first responders. They really like those neoprene ones.
Oh, yeah, they're great. And
Mhm.
and they did have a further reach than that too, than what you just described. But
Yes.
2 million is one mask for everybody in the county. To your knowledge, are there still masks available? Because I've got neighborhood groups, the real thing right
Right.
now is to get into the neighborhoods where the numbers are so
Mhm.
low on vaccination. And I get requests from those neighborhoods, and I'm sure other commissioners do as well. Are masks still available that we purchased?
Right, we did, we, like you said, we got them, they came in, we got them out and dispersed. Certainly, I can find out if we still have a few left, but they were, when we got them in, we got them back out. So, but I can look into that, Commissioner.
Would you please, and
Yep.
for a way to do this, because the important thing is public health. And then I'll also ask Ms. Osterberry, in my estimation, the freight train is coming. Are we going to be ordering more of these if we're kind of already out? Because there's still, and there will be, an increasing need for this, especially to the communities that maybe only a third of the people are vaccinated, that are so vulnerable. Is there plans for buying more?
Right, and yes, we are looking at strategically for that fall rollout and for our response. And, a lot of that will depend on what we've said earlier, just, the inventory that is still available and what we might still anticipate needing for the community.
Well, I know that all commissioners would be interested in helping that. Me personally, I don't care if it goes out with my name or not. If I can steer administration to the right places to deliver these things, I have no ego in that. And I am delighted to hear that you're making plans for the fall when numbers are going to go up. Questions from commissioners on this item? It's a receive and file item. If there are no questions, I'll take a motion.
Move to receive and file.
Support.
We have a motion and support to receive and file this item. Any other questions from committee members? Hearing none, voice vote on a receive and file item. All in favor, please say aye.
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 Aye. Opposed? Abstentions? Unanimously passes. Madam Clerk, what's item number 5 all about?
Item 5, requesting commission approval of a memorandum of understanding with Henry Ford Hospital.
Thank you very much. Are we back to our, who's introducing this? Are we back to our health officer, Ms. Osterberry?
No, hi, through the chair, it's Jennifer Caruso with.
Welcome, Ms. Caruso.
Hi, with HHVS. So this item, and I believe the following item, are programs that allow facilities such as Henry Ford or Beaumont or any other hospital or nonprofit clinic to provide access to discounted medication for the underinsured or uninsured individuals. So we were approached by Henry Ford and last year Beaumont to partner with them to support their access to this program.
Does that mean a financial commitment from Wayne County?
No, no financial commitment whatsoever.
Okay, and so why do they need the county?
Because they're required to have support from local governments to obtain this access to the program.
I see, so it's a federal program.
Yes.
Okay. The county does get money for indigent care through the airport parking tax. And so I'm not going to raise that as an issue today, given this discussion, but I think for down the road, how we're spending those dollars. And I think it approaches 20 million a year earmarked for indigent care in Wayne County. I think that's a pot of money we ought to be looking at very carefully to see how we're spending that and how we're getting that out, especially in these times. So thank you for that, Ms. Caruso. Questions from commissioners on this item? And if you want to, in a motion, combine it, the Henry Ford, along with, what was it, the Wyandotte Hospital? If you want to do items 5 and 6 together in a motion, that would certainly be appropriate.
I just have one question to Jennifer. So does Wayne County, do they just need the approval of a local government? Do we do anything with our population in recommending that they use Henry Ford services, or are we just totally like in a fake partnership or whatever?
Yeah, we do not recommend the services to individuals.
Okay, so, okay, I'll move approval for 5 and 6.
Thank you, Commissioner Moretti. And of course, for the record, that's thank you, Commissioner Dobb, that's a receive and file item.
Oh.
I see that Commission Counsel, Ms. Johnson has her hand up. You have something to add to this, Ms. Johnson?
Thank you, Chairman. So I would just ask that commissioners note the concern in the analysis. It's not due to the substance of the agreement, but it's an ongoing disagreement, I guess you'll say, that started last year with the Administration and Corporation Council, that they've taken a position that MOAs don't require commission approval. And they actually indicated that these two were submitted essentially under protest, and they don't agree that they require commission approval. The concern with that is that these agreements are not procurement, so they don't fall under delegated authority that you provide the CEO under the procurement ordinance, because we're not procuring anything. And because the charter says that you have a right to approve all contracts and you haven't delegated any other general authority to the administration, I've taken a strong position on your behalf that these agreements require your approval. So I just want commissioners to note that and note that they specifically stated in those cover letters that they disagree. And I think this will be an ongoing issue. So just please take note and read the analysis if you haven't had an opportunity to do so. Thank you, Commissioner.
Thank you, Counsel. And I want to come back to you here. I took note of that. You referred to, I believe, an MOA as the kind of agreement that it was opined that it wouldn't have to come before the commission. I don't know if you misspoke. Is that an MOU or an MOA, or what is the instrument here?
So, these agreements are called an MOA, which are memorandums of agreement, but really the title is irrelevant. And this is the position I've taken, because they'll say the same things about MOUs, which are memorandum of understandings, MOAs. And really, in another position I've taken is that you can't put a title on agreement and then all of a sudden say that it doesn't require commission approval. It's about the substance of the document. So I personally do not put any relevance on the title. However, they have stressed the relevance of a title to some extent. Therefore, I just mentioned it just because that's what they refer to it. But from our position, it doesn't matter what the title is. It's the substance and the fact that the charter says that all agreements, irrespective of title, all agreements require this body's approval, and you have not delegated such authority.
And I thank you for that. My question was more around the alphabet soup. I hadn't heard MOA before to use that. And I'll go one question back to counsel on this. Apparently, the federal rules say that the hospitals have to get the agreement of local government to proceed forward on this. And doesn't that in and of itself mean that it has to go before the legislative body for approval, that it just can't be an internal administrative approval for this? Do you have an opinion on that, Ms. Johnson, if I've stated it properly?
I don't recall the details of the legislation. I will tell you that when this was the first initially submitted, we did question why the county was entering into the agreement, because it wasn't clear. So I did have a conversation with Corp Counsel, and they explained it, and they provided some backup information. But I can't say yes to your question because I'm not exactly sure, but I'll again go back to the charter, which is clear, all agreements. So until you delegate that, it's all agreements.
Okay, well, I hope everybody heard that loud and clear, including Corporation Counsel, that is easy to come up in the future.
To that
Okay,
point,
yeah, Commissioner Marecki, please.
Alicia, is this kind of the similar to when we had something a couple weeks ago about COVID monies buying food from, I can't remember.
I'll get to you, Mr. Winter. Hang on. I'll get to you, Mr. Winter. You have to be recognized.
You're referring to the issue with Forgotten Harvest.
Yes, Forgotten Harvest.
That was similar, but a little different. In that instance, the argument was that the procurement ordinance wasn't applicable because it was a subrecipient agreement. And a subrecipient agreement is when the county has a grant with, let's say, HUD, and then under that grant, we're required to provide some type of service or program, let's say housing assistance. Then the county enters into an agreement with a vendor for housing. Well, they call the contract between the county and the vendor a subrecipient agreement. Again, that's a title, but it's called a subrecipient agreement. So in recent months, Deputy Corporation Counsel had opined that subrecipient agreements were procurements, therefore they didn't fall under the procurement ordinance because they were subrecipient agreements. Again, relying on a title that's been placed on it. And really a subrecipient agreement is just passed through grant funds. There's no rule that says that because something is funded by any particular source, let alone grants, that somehow that exempts you from the procurement ordinance. So it was a slightly different argument, but consistent with some of the issues that we've been trying to address behind the scenes with regards to agreements coming to this body for approval.
Yes. Okay. All right. Thank you very much. And thanks for looking out for it. Thank you.
Now I see Corporation Counsel is very anxious to wade into the pool here. I'm going to be a little cautious about this because this is not the place for Commissioner Counsel and Corporation Counsel to go back and forth with legal arguments on this with regards to the procurement ordinance. So I'm happy to let that conversation take place outside of the public meeting. So I'm cautious here, Mr. Winter, but I do want to recognize you for what you have to say on this matter. Please name and title, sir.
Yes, T.R. Winter, Assistant Corporation Counsel. And just to clarify a couple things on this agreement, taking into account your point that these larger issues will be dealt with in a different time and forum. These agreements from Henry Ford track agreements that we think were with the county through mental health and then have continued with DWIN in a similar form and continue today, but Henry Ford in getting guidance about how to best qualify for the federal program, and if they're audited to show that they're doing everything they need to do, came to us to execute similar agreements to those that are already in place with DWIN and have been probably since they became independent. That may be why the title Memorandum of Agreement was used. I agree with Commission Counsel that the title of an agreement is not that important. It's the substance of what's in the agreement. And I would say for these two agreements, we late last year went back to Henry Ford to draft them and make changes in a way that we believe made it fit within the delegated authority of the CEO to sign these, not a department, as a procurement for goods and services. Our basis for that was that under the federal definition, this is defined as a 340B service program, and that was the correct designation, although we do accept Commission Counsel's question that this is a little bit unusual form of a service, but that is how it is defined by the federal government. And I believe that's enough explanation for these agreements without, as you said, wading into arguments.
and we've already gotten in chest deep here, so I'm not wading any further. I hope that this continues on into the future, that we don't make some narrow legal calls to say, well, we've had this other agreement with DeWin, which is separate from this discussion here, but somehow legally we can shoehorn this underneath that agreement. We don't have to go to the commission for it. I hope that we continue down the path that's kind of established here today, as well as in the last instance that Commissioner Marecki brought up, that these things just come before the commission. And I think in the long run, I mean, this is tremendous for indigent folks to be able to provide some reduced cost medicine with regards to this. So my hope is we keep going down the same path with these agreements that is kind of established here now. You know, past practice, counselor, that goes for big stuff. We have a motion to receive and file items 5 and 6. Any further questions on this from committee members or comments? Commissioner Marecki.
Oh, no, I'm all set.
Oh, she's like, I'm ready to vote.
I'm sorry, through the chair. Are these approval items?
Yeah, I thought they were approval.
Oh, that's right. I'm sorry. I'm sorry. It's not receive and file. These are approval items. So we will be taking a roll call vote on this. Thank you, Pam and Makisha. Okay, so we have the motion to approve items 5 and 6. We're going to a vote. All in favor of approving these two items, please say no.
You want to do
Roll call. I'm there, Madam Clerk.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson. I don't think he ever joined. Commissioner Colleen,
Yes.
Commissioner Baker McCormick is not on the line either.
So where are we at with the vote, Madam Clerk?
We got yes from Marecki, Dobb, Colleen, and there's a no vote for, well, Commissioners Anderson and Baker McCormick aren't here to vote, so.
So the short story is motion passes.
Yeah.
Thank you. Madam Clerk, can we go on to the next item then, please?
Item 7, requesting commission approval of retroactive modification 1 to a 1-year intergovernmental agreement, service provider agreement with Detroit Wayne Integrated Health Network.
Okay, this is an annual agreement we have with the Detroit Wayne Integrated Health Network, AKA DeWin. Who is introducing this and can talk to us about what this $6 million going to the Mental Health Authority accomplishes each year?
Sure, it's Jennifer Caruso again through the chair. This is funding for mental health services, so treatment, evaluations, screenings for inmates in the Wayne County Jail. These funds are drawn down through the mental health network through DWIN, and they need to be drawn down every month. Billing is conducted by our jail health provider, which is currently WellPath. And we are able to receive reimbursement for all of these encounters.
And Ms. Caruso, is this only for treatment in the jail? Do any folks get any help once they're released if they need to continue to get mental health services? Does this contract address that at all?
The contract addresses discharge planning for continuity of care after their release, but it does not address the treatment post-release.
Okay, but we can give them a game plan to follow.
Absolutely.
Okay, questions from commissioners on this item?
No questions, but I will move to approve this item.
Support.
Moved and supported. This is a roll call approval item, just keeping myself straight here. Hearing no questions, we will go to a roll call vote. Madam Clerk?
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Killeen.
Aye.
Motion carried.
Thank you, Madam Clerk. I believe we're going to the addenda then, Madam Clerk?
Item 8 on the addenda, requesting commission approval of Amendment 1 to a 5-year professional services contract with Southeastern Michigan Health Association.
Thank you. SEMHA, Southeast Michigan Health Association, is a vehicle we have used for a number of years to contract for staffing. And it's always been a bit of a discussion for this, because when we hire through SEMHA for staffing, that means we're not hiring a county employee that may be putting into the retirement fund and other things. So my initial question here is, are there any job categories here that we are hiring through SEMHA that don't already exist? Are we just renewing contracts, or are we hiring totally new categories and individuals to fill those categories?
Yes, Carol Osterberry from Health and Human or HHVS. No, these are not, and these are temporary positions. You know, we had this temporary money came in for the code through the CARES Act. And so in order, again, for our response, we hired in these positions. They were, short-term temporary positions that were to help our response for the COVID response last fall and this winter.
From your discussion, Ms. Osterberry, it sounds like maybe because the term of this is through September of 2025.
Yes.
Have some people already come and gone with their temporary status?
Yes, that is correct.
And how many are we still carrying through this service agreement?
We have approximately 30.
Still with us?
Right.
Okay. And I have to ask Commission Counsel, I don't know when all of these folks came aboard, but Commission Counsel, since this is just before us today, could this money have been spent 2, 3, 4 months ago to hire these folks when this agreement had not yet been approved by the Commission?
Through the chair. So this is the first I'm hearing, or at least understanding, that payments have been made to individuals, but based on our ordinances, obviously this agreement requires your approval, and until you approve it, it should not be implemented. So this is a violation of the ordinance because it sounds as if, services have been rendered and paid based on a contract that wasn't properly approved at the time.
Is there a remedy, Counselor, Commission Counsel, at this point, since we have already violated our rules?
There are some penalty provisions in the retroactive section of the procurement ordinance. And in fact, Corporation Counsel is supposed to provide a report with that regard, so we can follow up as a staff with them to go through the process set forth in the ordinance.
Yeah, if you would, Counsel, everybody's under the gun and everything is such a moving target these days, and nobody has enough people. Nobody does. We don't have enough commission staff. There's not enough staff in administration. However, we can't have a leaky bucket here. We've had several discussions today about what has to come to the commission for approval and what has not, and what does not have to come. And now we're having this discussion about a contract that was started before it was approved by the commission. So I am very hopeful that administration and the commission can find a better way to work together so we don't run into these issues. There's always emergency procurement. There's other ways to go to the commission. But when I look at the paperwork that we didn't even see this until June 23rd, and I imagine hiring of these temporary folks was well underway before that. We just, I'm not looking at this as a battle at all in terms of authority or anything like that, but just much better communication that we don't, because there are going to be times a mistake like this could be very costly if we don't do it, if we don't follow our procedures properly. Commission members, committee members, questions on this proposal?
Mr. Chair, I don't have any questions. I think you've summed everything up perfectly. So I will move for approval. This is an action item.
It is.
Okay, move for approval.
Is there support?
Support.
I don't get the signal.
Thank you, Commissioner Marecki. I'm going to go back to Commission Counsel real quick here. Since this is an agreement that runs through 2025, is there a way, I don't know, do we need to amend it at this point going forward, Commission Counsel? Should we amend this to put an end date on it and then start a different agreement that comes to us in a timely fashion? I'm just asking Commission Counsel if there's it's been moved and seconded. We're going to vote on it here pretty soon. Is there something that needs to be done in terms of amending this, Commission Counsel, given the terms of the contract?
Through the chair, I'm not certain what benefit that anyone will gain from amending and separating this into two. If these services are needed, I would imagine that the administration would simply submit another contract, which I would say would have to be a modification to this one. So it will probably just be more paperwork with the same end result. So I don't see the benefit in requesting an amendment at this moment in time. I believe if the commission is going to ultimately approve this contract for the staffing, then there's no need to go through any additional steps, but to take approval now. And then I will follow up, or staff will follow up afterwards to get some additional information and to determine, to look at this against the procurement ordinance and to see and to work out with Clerk Council the process so that they can comply with that ordinance on their side.
Thank you, Counsel. I asked the question because I don't have unlimited knowledge of legal situations like this, so I rely on you. Ms. Osterberry, did you have a comment here?
Just a clarification, this is an amendment.
Yeah, it's amendment number one.
Okay.
Yeah.
All right, that's
Yeah.
all.
But it's pretty much already happened to a large degree. So, okay. We have a motion on the floor before us for approval of item E8 on the addenda. Are there any questions from commissioners before we vote? Okay, Madam Clerk, can we take a roll call vote on this?
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Colleen,
I'm an aye.
motion carried.
Thank you very much. What's next on our agenda, Madam Clerk?
If such other matters as may be properly submitted before the committee.
The temporary chair is unaware that any matters have been properly submitted, so we will roll to the next item on the agenda, which would be
Public
what?
comments.
Did anybody submit any email for public comment?
No, we haven't received any emails.
Okay, I guess then the thing to do would be to open up to anybody that's attending this by Zoom or by phone, for any member of the public that would like to have comment. Madam Clerk, what do people have to do? Just unmute themselves if they want comment?
Yes.
Okay, so if you're a member of the public and like to have a couple of minutes to address the Health Committee of the Commission, we will certainly take your input. We do not have back and forth conversations. Public comment is exactly what it says, and it's the same here as in every other public body. We take your comments. If we need to get back to you, we will, but we're not going to get into a discussion during public comment. So any member of the public who would like to have comment, please unmute yourself and tell us who you are, and you'll have a couple of minutes on the floor. So that was my first call. Is there any member of the public on call number 2 that would like to have comments? To make sure we don't miss anybody, I'll put out a third call. Any member of the public that would like to have public comment at this time? Hearing none, Madam Clerk, what's the next item on the agenda?
Adjournment.
So moved.
All right, it's been moved and supported, and I'm going to use the awesome power of the chair to say it's been moved, and I'm going to call it that we stand adjourned. So thank you, everybody. Thank you very
Bye.
much.
Thank you.
Thank you.